of all kinds of cancer by having children and nursing the baby. Okay, menstruation. Of course, many of the females then will know that there are lots of issues with menstruation. Too little bleeding. Too little bleeding may indicate. Too little bleeding doesn't mean that you have too little bleeding when you were a teenager until now. No, too little bleeding means that suddenly you have your bleeding is a little bit decreased a lot. So normally you know how much bleeding you have, but then suddenly in a few months you have too little bleeding. That shows some kind of issue with the hypothalamus or pituitary gland. So if you remember, I talked about the normal endocrine pathway. It is the hypothalamus is the part of the brain that control the endocrine system, and pituitary gland is like the second in command of the endocrine system. Too much bleeding, again, it's not like okay you have too much bleeding since you were a teenager. No, it means that suddenly 1 or 2 months or 3 months or several months your bleeding is higher, is more than previously. So it can be caused by STD. That's the most common cause. Infections of the bacteria will cause increased bleeding. Or if you are taking new medication, if you are taking some kind of medication, then you should consult with your doctor. Will that increase your menstrual bleeding? Or problem with blood clotting. Usually problem with blood clotting, people will know about this. Problem with blood clotting. It can be hemophilia. Hemophilia, then people will know, but people will know when they were a kid, but then it can be due to other bloodborne diseases. Dysmenorrhea. Dysmenorrhea is very common, painful menstruation. Almost half of the women will experience that. Dysmenorrhea. It is caused by high level of prostaglandin, endometriosis, or ovarian cyst. So some women, they have so painful that they have to stop going to school in high school when they were high schooler. It can be due to a high level of prostaglandin, and it has a family history. It is genetics. Endometriosis, we will talk about it in the last slides. Ovarian cyst is basically is the corpus albicans, the white body corpus albicans. They do not get reabsorbed and degenerate, so they remain in your ovary. The corpus albicans, they remain in your ovary that form this cyst. The cyst can be benign. Then in this case it won't cause any cancer, but it will cause a painful menstruation. PMS, premenstrual syndrome, okay. Include mood swing, headache, joint pain, digestive upset, and sore breast. All these are part of the PMS. It affects women, and it directly affects the man if they are the husband, boyfriend, or partner, whatever. This PMS has many women will take a painkiller for that, like Motrin. Some women, they would use hot water bag, those hot water bag to help. Yeah, applying heat in the lower part of the abdomen helps to relieve the pain. Infertility. Okay, infertility is also a big issue for women. So the definition is that failure to conceive after 1 year of regular unprotected intercourse. So approximately 15% of the couple, they are infertile. Okay, 40% are due to men, 40% due to women, 20% due to both. So it is fair. We are not blaming it all to the women. 40% due to men, 40% due to women. Causes low sperm count. Okay, again, men's issue. Okay, smoking. I already mentioned smoking. Okay, alcohol consumption, or even sedentary lifestyle. If we don't do too much exercise, a couch potato, Body weight in women, obesity. Okay, linked to ovulation failure. It is kind of it is like a inverted U-shaped curve. Okay, what I mean is that inverted U-shaped curve is like this. So this is the weight. X-axis is the weight. Y-axis is the fertility. Yeah. Y-axis is the fertility. Okay. So what it means is that when women, they have very light, like those bulimic supermodel, they don't have any body weight. That means that in this extreme case, then it will be very difficult for them to get pregnant, because actually some body fat will help to increase pregnancy. Body fat actually I don't want to say anything. Okay, and then you need to have some body fat to increase the pregnancy chances. And then if you are obese, that means at the other end of the extreme, it will actually decrease the pregnancy rate by something called ovulation failure. It will actually stop ovulation. It is the same when women, they're too skinny. When they're too skinny, they will have irregular menstrual cycle, and they may even have stopped the menstrual. They will actually no period when women are too thin, because they don't have enough nutrition to support ovulation, to support the pregnancy. So the period will actually stop. So don't get too thin, don't get too overweight. Okay, a healthy normal BMI is the best for everything. Okay, pelvic inflammation. Okay, or can block the oviducts. Then in this case, women cannot get pregnant. Pelvic inflammation is also due to infection. Again, endometriosis also causes infertility in women. Well, how can we treat infertility? It's not the end of the world. There are methods to help. We call this assisted reproductive technologies. Okay, ART. It's an art. Okay, so artificial insemination by donor. Sperm are placed in the vagina by donor, meaning that if the man has issue with the sperm, then they really want to have a baby, then they can get the sperm from the sperm bank and then place the sperm in the vagina. Or donor can be women's partner or a donor. What I said is in the sperm bank, a partner. So the man may have impotence, difficulty to get erection, but the sperm is perfectly fine. In this case, then we can do this artificial insemination or intrauterine insemination, IUI. So uterus is prepared by administering fertility drug, and the sperm is placed directly in the uterus. Okay. There's one treatment that I heard that is very similar. Is that they will flush the female reproductive system with some kind of natural plant oil or something like that, some kind of solution or plant oil. They said that it will help to restart or it's like resetting the female reproductive system. And then usually after they did that, it will increases the chances of women getting pregnant. And then of course the second one, the famous one, in vitro fertilization, IVF. So eggs are harvested immature, and then we wait for the egg to mature in the glassware, literally in a dish. Yeah, literally. And then sperm are added to the dish. Okay. And then under the microscope, people can see that the egg is fertilized. And then they will take the fertilized egg, and then they will actually wait for it to split, so that the fertilized egg or the zygote they will let the zygote to divide in the dish for a little bit until it becomes a blastocyst. And then when it becomes a blastocyst, then they will they put the blastocyst back to the uterus. Hopefully the blastocyst will implant in the uterus, and then it becomes the embryo. And usually they don't just use one blastocyst. They would usually take multiple blastocysts and then inject it into the uterus, so that hopefully they will get one successful implant to become embryo. Sometimes the woman may get 2 or 3 blastocysts simultaneously implanted in the uterus. Then in this case, the woman will have fraternal twins. And then gamete intrafallopian transfer, gift. Gamete intrafallopian transfer. So basically, they put the zygote. They should just call it zygote. They place the zygote, the fertilized egg, in the oviduct. So it is very similar to IVF, but they actually do this, I would say, more invasively. So you know that the IVF, as I mentioned, that after the egg is fertilized, becomes zygote, they wait on the dish until it divide, become blastocyst, and then they would inject the blastocyst back into the uterus. So it is not as deep as this one. This one go all the way to oviduct. They wait for the zygote to form and then place in the oviduct. Then they will because that is closer to the natural pregnancy. As I mentioned before, the fertilization occurs in the oviduct. So this is what they try to do. They try to simulate the natural pregnancy, so that the oviduct will move using the cilia inside the oviduct to move the zygote out to the uterus. Then the zygote will have the highest chance to embed in the uterus. So that's the whole rationale. They try to simulate the natural pregnancy. Surrogate mothers. So basically, they will get the embryo from a couple. It can come from the IVF. Usually it's from IVF actually, and then implant to another woman for development to occur. Maybe because the mother has a cardiovascular disease. So the mother is not physically fit enough to get pregnant, but the mother produces healthy eggs. So in this case, they can still be a parent. Then they have to literally pay or hire another woman for 10 months, for 9 months. Yeah, for 9 months. Intracytoplasmic sperm injection. It sounds very fancy, but basically we inject one sperm into the eggs and then place in the uterus or oviduct. So it is a little bit different from IVF in that IVF we just put a lot of sperm with eggs, several eggs, and then let the sperm to fertilize the eggs by themselves. It's like kind of natural. This one is not natural in that we artificially inject a sperm into the egg. So it is literally artificial fertilization. Yeah. So that's the end of it. I'm sorry to take so long. It is a very long lecture.